My name is Karen Underwood. I have been a registered nurse for 25 years and a nurse manager in a very busy cardiac cath angiography lab in the East Bay of San Francisco, California. The purpose of my speech is to inform my audience of the history of the healthcare reform in the United States. I want to persuade you all why Americans have the right to access quality healthcare. I want you to understand that the implications of being uninsured. My central idea is to support and endorse the Affordable Care Act, also known as Obamacare. This topic is very significant. Baseline estimates show that in the United States in 2013, the percentage of Americans without the basic health insurance coverage was 13.4%, approximately 42 million American men, women, and children, according to J.C. Smith and Associates in September of 2014. Many Americans lack health insurance because of poverty, loss of jobs, and because they were denied health coverage because of pre-existing conditions. Today I will discuss 5 main points discussing the history of healthcare reform and why I strongly support the Affordable Care Act. The 5 main points that I'll be discussing today include the first one, former President Harry S. Truman's proposal for a National Health Insurance Plan, NHI. Second, being President Lyndon Johnson when he signed the Medicare and Medicaid into law. The third point, President Barack Obama signed the Patient Protection and Affordable Care Act, also known as Obamacare. Point number 4, uninsured Americans are less likely to seek preventative health care, leading to serious health implications. And my last point, number 5, the National Health Insurance Plan will have economic benefits for the United States. On point number 1, on November 19, 1945, the 33rd President of the United States, Harry S. Truman, addressed to Congress. He proposed the Economic Bill of Rights. In his address, President Truman argued the health of American children, like their education, should be recognized as a definite public responsibility. He also stated that Americans have the right to adequate medical care and to enjoy good health. He also included in his address to Congress that every American citizen should have the right to adequate protection from economic fears of sickness. President Truman's plan was to ensure that all communities, regardless of their size and income level, had access to doctors and hospitals. There were 5 issues that needed to be addressed. First one being lack of doctors, nurses, dentists in rural and low-income areas of the United States. The earning incomes of the people in the rural communities made it difficult for physicians to practice there and make a living. Therefore, it was difficult to attract healthcare professionals, doctors, and dentists to the rural communities. People in the rural communities were not getting the same quality of medical care as those who live in the city. The second problem facing Americans was the lack of quality hospitals, clinics, and healthcare facilities to care for the people, especially in the rural communities. There was a need to develop public health and maternal and child care. President Truman wanted to increase the services received by expectant mothers and infants to reduce the mortality rates and provide vaccines to prevent the spread of communicable diseases. The solution to the first 2 problems, President Truman proposed to provide government funds for the construction of new hospitals and to attract more physicians to the rural communities. He also wanted to create a national standard for hospitals, clinics, and healthcare facilities. This called for a board of doctors and public officials to be created. The board would create a standard that ensured all hospitals met these standards. President Truman wanted to invest in medical research and professional education. President Truman stated we must learn and understand more about health and to prevent and cure diseases. Diseases of the heart, kidneys, respiratory, cancer, and mental illness. He wanted to train more physicians in highly specialized areas such as cancer, the leading cause of death, and mental illness. The high cost of individual health medical care is the #1 reason people do not receive the care they need. The fourth problem President Truman outlined, and the most controversial, President Truman proposed the National Health Insurance Plan. This fund would be funded by the federal government and it would be open to all Americans. Individuals would pay a monthly fee into the plan, and the plan would pay for any and all medical expenses. The federal government would pay for the cost of the services to the doctors who chose to join the program. The fifth problem was the loss of earnings due to illness and disability. Sickness brings loss of wages. Payments of benefits to replace lost wages would be paid through the expansion of the Social Security program. What happened to Harry Truman's plan? President Truman's bill was proposed to Congress as a Social Security expansion bill, but it never passed. The American Medical Association, the AMA, campaigned against the bill and instilled fear of communism and socialized medicine. President Truman was not able to create the health care program he wanted. This resource was information obtained from the Harry S. Truman Library and Museum. My main point number 2, President Lyndon Johnson. On July 30th, 1965, President Lyndon Johnson signs Medicare and Medicaid into law in Independence, Missouri, with former President Truman at his side. This is the first time that the federal government played a direct role. According to Steve Anderson in March of 2015, the budget for Medicare was $10 million and 19 million Americans signed up for Medicare the first year. A little Medicare trivia: former President Truman was issued the first Medicare card. Medicare is a social insurance program for all Americans age 65 and older who have worked and paid into the system. Medicare is funded through payroll taxes, and Medicare has 2 parts. Medicare Part A covers hospital care and limited skilled nursing and home health services. Medicare Part B is the medical insurance. It covers the physician fees. Today, the 2 parts are called the original Medicare. Today, more benefits are offered through coverage for the disabled under age 65 who have debilitating diseases such as end-stage renal disease, on dialysis, and amyotrophic lateral sclerosis, also known as ALS. Medicare Part D offers prescription drug benefits. Medicaid is a state and federally funded health insurance program for individuals and families and people with disabilities of all ages and with low income and limited resources. State participation is optional, but to date all states do participate. Each state operates its own Medicaid system, so benefits will vary from state to state. Medicaid covers hospital and medical services, long-term care, including dental. There are 2 types of Medicaid coverage. Community Medicaid covers people with little or no insurance. Medicaid nursing coverage pays for the cost of nursing homes, except for the insured pays most of his or her income towards the nursing home cost, keeping only $66 a month to pay for other expenses. In August of 1997, former President Bill Clinton signed a law extending Medicaid coverage to children whose families earn too much to qualify for Medicaid, but not enough to afford private insurance for their children. This program is called SCIP, State Children's Health Insurance Plan. It gave health insurance and preventative care to nearly 11 million American children, according to the Centers of Medicare and Medicaid Services. This information was retrieved from the Centers of Medicare and Medicaid Services. Main point number 3, President Barack Obama. President Barack Obama signs the Patient Protection and Affordable Care Act on March 23, 2010, also known as Obamacare. Under this plan, it mandates that all citizens that can afford to purchase insurance must do so or pay a 2% penalty on your household income. People with low incomes or moderate incomes that do not qualify for Medicaid qualify for tax credits and subsidies to help cover the cost of the insurance purchased through the marketplace. Expansion of Medicaid expanded eligibility to include people with incomes up to 138% of the poverty level. For a family of four, that is $24,250. 23 states opposed Medicaid expansion. In this visual aid, you can see the current status of state Medicaid expansion decisions. The dark blue represents those states that have adopted the Medicaid expansion. That is 31 states, including DC. The light blue, which is Utah, the adoption of the Medicaid expansion is still under discussion. And then in the orange is those states not adopting at this time the Medicaid expansion. This information was found on the Kaiser Commission on Medicaid and the Uninsured. Under the Affordable Care Act, it allows families to keep their young children on their health insurance plan to the age of 26. How is the insurance plan purchased under the Affordable Care Act? Insurance is purchased directly through each state's insurance marketplace. The marketplace provides 4 types of plans: bronze, silver, gold, and platinum, also known as the metal tiers. Each plan offers different monthly payments and out-of-pocket costs, deductibles, and co-pays. As you can see in this chart provided by Affinity Health Plans, metallic tiers, the bronze plan cost to purchase is the lowest, but the patient responsibility is 40% and the plan's responsibility is 60%. And as you move through the metal tiers, you may see that the platinum plan, the cost to purchase is the highest, the patient responsibility is 10%, and the healthcare plan responsibility is 90%. On to my main point number 4. Uninsured Americans are less likely to receive preventative care, leading to serious health implications. The Kaiser Commission on Medicaid and the Uninsured in 2014 state that the majority of uninsured are low-income working families. People of color are at higher risk for being uninsured than the non-Hispanic whites. 61% of the uninsured said that the main reason that they were uninsured was because the cost was too high and they had lost their jobs. According to the American College of Emergency Physicians, 8 in 10 are working families that cannot afford health insurance, and most are not eligible for public programs. 66.7% live in households with a full-time worker, and 20.2% with a part-time worker. 20.4% of African Americans and 33.5% of Hispanics are uninsured. The uninsured are less likely to receive preventative care for major health conditions and chronic diseases. In 2013, only 1 in 3 uninsured adult, 33%, reported a preventative visit with a physician in the last year, compared to 74% of adults with employer coverage and 67% of adults with Medicaid, reported by the Kaiser Commission on Medicaid and the Uninsured in 2014. Kay Bailey in 2012 reported the uninsured women are more likely to be diagnosed in the advanced stages of breast cancer than the insured women. Uninsured older adults ages 50 to 60 were less likely to report having been screened for cancer in the past 5 years, according to the Kaiser Commission on Medicaid and the Uninsured in 2014. In addition, the uninsured have a significantly higher rate of mortality than those who are insured, because the uninsured people are more likely to be diagnosed in late stages of diseases and have shorter survival. According to Jay Hadley in 2002, he reported that the uninsured cancer patients are more likely to be diagnosed in the late stages and have shorter survival. Uninsured heart attack patients have higher mortality. Uninsured patients who have end-stage renal disease programs are more likely to have worse kidney function. Uninsured patients with appendicitis are more likely to have ruptured appendix, and the uninsured trauma patients are more likely to die. Being uninsured can lead to serious financial consequences. Dan Manigan in 2013 stated, "Medical bills are the biggest cause of U.S. bankruptcies." Summary findings from Christina Lamontage in 2014 56 million American adults ages 19 to 64 will be contacted by collection agencies for unpaid medical bills. 17 million American adults ages 19 to 64 will receive a lower credit rating because of high medical bills. 1.7 million Americans will declare bankruptcy due to inability to pay medical bills. In addition, the inability to pay for health care leads to those without insurance to delay care and forego getting prescriptions filled. To save cost, over 25 million adults ages 19 to 64 will not take their prescription drugs as indicated, including skipping doses, taking less medicine than prescribed, or delay getting prescriptions filled. When people do not fill their needed prescriptions due to cost, it leads to poor outcomes in health. Delaying care leads to poorer health and increased medical cost and medical expenditures in the long run. The cost gets spread across the board to everyone through cost shifting. Poor health reduces a worker's annual earnings by 15 to 30%, as reported by Jay Hadley in 2002. Poor health of the family member often leads to reduced work by family caregivers. Point number 5, the economic benefits. Ensuring American citizens the right to quality health care will benefit the economy of the United States. Reports show from procon.org in 2015, healthier workers are more productive workers, equaling fewer days lost from work, on average of 4.7 days less than the uninsured. The Institute of Medicine reported the U.S. economy loses 65 to 130 billion annually as a result of declined worker productivity due to poor health and premature deaths among the uninsured, as cited in procon.org in 2015. The cost of escalating out-of-pocket expenses are forcing people to delay paying their mortgages, sell their homes, and cut back on normal household expenses. Retired families are spending more of their savings on health care expenses. Fewer lost days from work allows individuals to contribute more to the economy by increasing the demands for goods and services. The right to health care will save lives. A study by Bergman and Associates in 2012 reported that 44,789 Americans between the ages of 25 and 64 die each year due to lack of health insurance. Since the signing of the Affordable Care Act in March of 2010, 16.4 million Americans have gained coverage according to hhs.gov/healthcare in June of 2015. Gains came from the enrollment in the marketplace, from the option of young adults to stay on their parents' plan until the age of 26, and from the Medicaid expansion. More people are eligible now for coverage. What does that mean? Americans are receiving more preventative care and leading healthier, more productive lives. The economy is seeing the slowest growth in healthcare costs in nearly 50 years. Healthcare spending in the United States has tended to outpace the overall economic growth for the last 5 decades, according to Jay Furman in 2015. In conclusion, let's recap my 5 main points. According to J.C. Smith and Associates, baseline estimates show that in 2013, the percentage of Americans without basic health insurance was 13.4%, approximately 42 million American men, women, and children. Since the beginning of the 20th century, presidents have been trying to pass the National Health Care Plan have met much opposition, beginning with former President Harry S. Truman's proposal to pass the National Health Insurance Plan. Point number 2, Medicare and Medicaid was the first time the United States federal government played a role in health care, signed by former President Lyndon Johnson, bringing health coverage to 19 million Americans the first year. And point number 3, President Barack Obama signed the landmark Patient Protection and Affordable Care Act on March 23, 2010, giving people with low or moderate incomes that do not qualify for Medicaid tax credits and subsidies to help cover the cost of insurance purchased through the marketplace. Medicaid expansion increased eligibility to those with incomes up to 138% of the poverty level. Endpoint number 4. Uninsured Americans are less likely to receive preventative care, leading to serious health implications like being diagnosed in the advanced stages of diseases, increasing the mortality rate among the uninsured, and medical bills are the biggest cause of U.S. bankruptcies. My last point, ensuring American citizens the right to quality health care will benefit the U.S. economy by fewer lost days from work and increased demand for goods and services. Preventative care leads to healthier and more productive lives. 16.4 million Americans have gained health coverage since the Affordable Care Act was signed in March of 2010. I believe that every citizen of the United States has the right to quality health care. It should not be a luxury to only those that can afford it. I see the consequences of people coming into the hospital sicker because of being uninsured and the fear of the financial burden from the lost time from work. Senator Ted Kennedy, in his final days, wrote a letter to President Obama in May of 2009. In his letter, he stated, "I came to believe that very soon, affordable health coverage will be available to all Americans, where the state of the family's health will never again depend on the amount of the family's wealth." And while I will not see this victory, I was able to look forward and to know that we will, yes, we will fulfill the promise of health care in America as a right and not a privilege.